So today I'm going to be doing some nasotracheal suctioning. Before I start, I would introduce myself, make sure it's the right patient. I would then go on to explain, especially if they haven't had it done before, what exactly the process is going to be. So I will let them know that this procedure will be uncomfortable. It'll be a short procedure. It won't last too long. And that this is going to help remove any gunk that they have in their airway. And once they're okay, once they let me proceed, I will then wash my hands. I would put on some sterile gloves. I don't have any sterile gloves at the moment, but I do have some normal gloves here. So I'll put those on. I'm going to want some water-soluble lubricant, maybe some normal saline, and we're going to want the vacuum device, suction device, and what we're going to do is this part here will be hooked up to the machine to be suctioned, and this will be my non-sterile hand, and this one right here will be my sterile. Basically, before you start, they are gonna most likely have a trumpet which will be put in. I don't have a mannequin or anything like that to actually demonstrate that, so I'll just kind of continue on explaining. You'll want to lube up the catheter ends pretty well, and a good way to, or before you do that, a good way to indicate that the suction is working really well is to use some normal saline, and you'll block off the little valve part here, which will then start suctioning, and you can use the normal saline, use a little bit, and see if it's suctioning and adjust from there. And continuing on from there, you'll want to put some lubricant on this pretty well. That way it goes in a little easier, doesn't cause too much discomfort, and you'll start kind of slowly putting it through the trumpet. Oh, I forgot to mention, before you do any of this, after the patient gives you the go-ahead, you're going to want to hyperoxygenate them for at least 30 seconds. All right, and then we'll start putting the catheter in very slowly, not very slowly, but at a decent pace. Make sure the patient's still pretty comfortable, even though it's not a comfortable procedure. And you'll feel some resistance a couple times, as long as you don't have to push too hard, or it's not anything too major and it still goes without being forced. You can keep going. And then once you get far enough, it'll trigger a cough, which then you'll pull back about a half an inch. And then around that time is about the time you can start suctioning. And as you suction, the whole suction should only last about 10 seconds. And I'd say probably about the time you can hold your breath. So start suctioning, kind of slowly pull all the way out. Then once the catheter comes out all the way, you can stop suctioning. If this patient doesn't need to be suctioned again, sometimes they won't. That's fine. If they do, you can just kind of use the suction device and use some normal saline and kind of clean out the tube. I would then discard of anything in the proper manner, and I'd reassess my patient. I would check on their oxygenation once their mask is replaced and everything. Make sure they're doing okay. Make sure breath sounds are better. And once they're comfortable and all set, nothing else I can do for them, I'll leave them on their day.